come in.
Hi, my name's Sarah and I'm a medical assistant here in the practice today. Before we get started, can I go ahead and verify your name and date of birth?
Yes, my name's Alicia Black, and my date of birth is 10/24/2001.
Alrighty, Miss Black, what brings you in today?
I'm just getting like shortness of breath, a little bit of like tightness in my chest when I breathe, and it makes it hard to breathe.
Alrighty, I understand the concern there. I'm going to go ahead and ask you a couple questions about that shortness of breath you're having, just to get an idea so our provider can help you best today. Where would you describe the location of that shortness of breath? You just want to go ahead and show me kind of with your hand?
Kind of like just like in my sternum, like my upper chest area.
Alrighty. And how would you describe the quality of that shortness of breath?
Not very good. Like it hurts to breathe. Like it feels like I can get the first half of my breath in just fine, and then once it turns into like a deep breath, I'm struggling to breathe. It almost feels like a little bit raspy.
Alrighty. And on a scale of 1 to 10, 1 being a normal breath, 10 being so shallow you can barely breathe, how shallow would you say your breath is?
Probably like a 6 or a 7.
Alrighty. And does it feel like there's anything kind of restricting, catching, blocking?
It doesn't feel like phlegmy or anything like that, but I would say like it catches once I go towards like that deep breath. Like it just gets like tightness in my chest.
Alrighty. And where would you say it catches at?
Just like halfway through my breath, like once it turns into a deep breath.
Alright, and is that in your sternum too?
Yeah, same spot.
Alrighty. And I know you described the shortness, how shallow your breath was already, but overall, how would you describe it on a scale of 1 to 10? 1 being your normal best day, 10 being the worst possible.
Probably like a 5, maybe a 6.
And would you place that in the mild, moderate, severe?
Probably moderate.
Moderate.
It's not severe, but it's more than mild, so moderate.
Alrighty. And then how many times a day would you say that you're experiencing that shortness of breath?
Well, it depends on how active I am, because I feel like I get the shortness of breath the more active I am, like walking to class and walking upstairs. So if I'm like more active that day, then it happens more times. So
Gotcha.
like anywhere between 5 and 10
Alrighty.
times a day.
And then how does it last? Does it stop with the activity or does it last past the duration of your activity?
It lasts like 10 to 15 minutes after it's over, maybe. Like I feel like it's like once my heart rate settles, then it kind of like returns to normal. I'm not necessarily like tracking it, but yeah.
Gotcha. And granted, it varies with how many times you're active in a day, but how long would you say is typically going between those spells of shortness of breath?
Probably between like 1 and 2 hours.
Alrighty. And then why don't you go ahead and tell me the story of when you first started having these symptoms? How did it come about?
So I had a pretty bad cold. I went to a doctor. I didn't have anything other than just a cold. And then I went on a trip with my friends to New Orleans, and we were up late at night and not getting much sleep and being very active during the day. And on the bus ride home, I just thought I was coming down with that same cold again, but I didn't really have any other symptoms, and I just was really tight in my chest. It was kind of painful, and so that's when I started noticing it, and I thought it would go away, so I didn't come in right away, and it didn't, so here I am.
Alrighty. And since you've gotten back from that trip, are there any scenarios or different settings where you feel like you're consistently feeling shortness of breath, just besides activity?
No, I don't think so. I don't really get it like laying in bed or anything like that, but just like I went and played like pickleball with my friends, and like it was bad then, but no, just like activity.
Alright. And are there any settings where you feel like it's a little bit better?
Indoors is good, or if it's like cooler out, but when it's hotter out, I feel like it's worse because like I feel like it's like even more humid and harder to get in that breath.
Mhm.
But
Alrighty. And are there anything that you've tried to help it?
not necessarily. I've been kind of taking it easy and like going to bed early and things like that. I took some allergy pills like Zyrtec, just like over the counter, but that wasn't necessarily for the shortness of breath. There's just like pollen and allergies and stuff.
Do you feel like any of that's had any positive or negative effect on your symptoms?
I think like the getting good sleep has been maybe helping a little bit. I'm not really sure, but the allergy pills, no, that's just like separate.
Alrighty. And is there anything besides activity that makes it worse?
No, I don't think so.
Alrighty. And then, do you have any signs before you start feeling short of breath? Anything that kind of lets you know it's about to start?
Not really. I would just say like the first thing that I notice is my chest feels tight. Like that's the first thing. And then like I notice it when I start breathing, and then I feel like it gets worse and feels raspy, and then yeah.
Alrighty. So it's kind of progressive.
Yeah. I mean my heart rate increases because then I can't breathe as easier. So, but other than that, no.
Alrighty. And then do you have any associated symptoms? Is there anything that kind of coincides with that shortness of breath?
An increase in my heart rate. Like sometimes it feels like my heart's racing a little bit, but other than that, no. I'm still getting over some cold symptoms, but I think that's separate.
Do you ever feel like dizzy or lightheaded?
I get lightheaded sometimes when I stand up too fast, but I don't think that necessarily has anything to do with it. It might, but that happens occasionally, even just like in my day-to-day life.
Alright. Any blurry vision or headaches?
Mm-mm.
No. Any nausea?
Mm-mm.
Do you have any feelings of like sweaty hands, shakiness, anxiety going on with it?
Not really, no.
No. Alrighty. And then that wraps up my questions about your shortness of breath, but I do have a few more for you. Have you had any recent illnesses or procedures done?
I had kidney stones this past summer, so I had surgery to get those taken out. So summer, and then in the 8th grade, I had my tonsils and my adenoids surgically taken out also.
Alright. Can you give me the year on both those?
Summer of 2023 for the kidney stones and 2017 for the tonsils and adenoids.
Alrighty. And then, have you been feeling ill lately at all besides your shortness of breath?
Just a little head cold, but other than that, no.
Is anyone in your family sick right now?
Yeah, my dad has like the same cold.
And have you been exposed to him lately?
Yes.
When's the last time you saw him and for how long have you been around them?
I saw him yesterday and I started seeing him Friday, so Friday, Saturday, Sunday, 3 days.
Alrighty. And then, do you smoke at all?
Occasionally,
Alrighty.
but not like I'm practice, just like maybe once a month if that.
Alrighty, would you say it's like socially maybe?
Yeah,
What are we smoking?
just cigarettes.
Alrighty, do you use e-cigarettes at all? Any vapes?
Mm-mm.
Alright, and then do you drink at all?
Just socially.
Right. What would you describe as socially? How many drinks would you say we're having?
2.
2, what timeline?
Like per
Like per
month, like
per sitting, per week, per month?
probably like 2 a week.
2 a week. Alrighty. And are you currently on any medications?
Mm-mm.
No, so no prescriptions?
Mm-mm.
Not even ones that aren't prescribed to you?
Nope.
Anything over the counter?
Just allergy medicine, Zyrtec.
Alrighty, and any vitamins or supplements?
Occasionally vitamin C, but
Alrighty. Then do you have any allergies to anything?
mm-mm.
Any medications?
I'm allergic to cephalexin.
Alright, cephalexin. And then anything environmental, any foods,
Dogs,
dogs.
but no foods.
Alrighty. Well, that wraps up my questions for you, Miss Black. I'll go ahead and get this out to our provider and she'll be in with you shortly, alright?
Okay, thank you.
Alright, yes ma'am.
Have a good one.